In this session, we'll be discussing about the mediastinum. So mediastinum is defined as the space or septum between the two pleural sacs, limited on each side by the mediastinal pleura, extent above thoracic inlet, below diaphragm, in front sternum, behind 12 thoracic vertebrae. You can see here. So in this center part will be the mediastinum. On either side there will be pleural sacs closing the lungs. You can see here this entire structure is called as mediastinum. You can see it is having pericardium with heart, great vessels. You can also see here trachea. You can see the branches of arch of aorta. You can see the brachiocephalic veins joining to form the superior vena cava. You can see the vagus and phrenic nerves. So many important structures lie in the mediastinum. So this is a horizontal section where you can see this is the mediastinum. On either side you can see the lungs. So this is an anterior view where you can see this is the central part, which is the mediastinum. On either side you can see the two pleural sacs having the lungs. Divisions. So an imaginary plane extending from sternal angle anteriorly to lower border of T4 posteriorly divides mediastinum into two parts, superior mediastinum and inferior mediastinum. So you have to remember this plane extending from sternal angle to the lower border of the fourth thoracic vertebrae. So this plane divides the mediastinum into two parts. The part of the mediastinum above this plane is the superior mediastinum, and the part of the mediastinum below this plane is the inferior mediastinum. And once again, this inferior mediastinum, by the presence of pericardium and heart, will be divided into three divisions: anterior mediastinum, middle mediastinum, and posterior mediastinum. You can see here, this is the imaginary plane extending from sternal angle anteriorly to the lower border of the T4 posteriorly. Above this, it is the superior mediastinum, and below that this entire part is the inferior mediastinum. And with the presence of the fibrous pericardium enclosing the heart, this inferior mediastinum is divided into anterior mediastinum anterior to the fibrous pericardium heart, posterior mediastinum posterior to the fibrous pericardium and heart, middle mediastinum which contains the fibrous pericardium and heart. So in the entire mediastinum, there are two locations where both pleural sacs are in close proximity. So one is behind the body of the sternum, extending from sternal angle to the fourth costal cartilage. And the second place is opposite T8 and T9, where esophagus crosses in front of the descending thoracic aorta. The mediastinal pleura of both sides will form mesoesophagus. So at these two places, the pleural sacs are in close contact with each other. Superior mediastinum boundaries: in front, manubrium sterni; behind, bodies of T1 to T4 and intervertebral disc between them and the anterior longitudinal ligament. So above it will be the thoracic inlet, below it will be the same imaginary plane extending from sternal angle anterior to the lower border of the T4 posteriorly, on each side limited by the mediastinal pleura. See, this is the superior mediastinum. Posteriorly T1 to T4, anteriorly the manubrium, inferiorly the imaginary plane, and above it is the thoracic inlet. On either side it will be the mediastinal pleura. So arrangement of the structures. So for convenience sake, we'll divide it into retrosternal, intermediate and prevertebral. So if you see the retrosternal contents, it will be the sternothyroid and sternohyoid muscles immediately attached to the manubrium. Then behind that will be the thymus gland. Then right brachiocephalic and left brachiocephalic. Then upper part of the superior vena cava and left superior intercostal vein. So if you see here, majority of the structures are venous structures, retrosternal, behind the sternum. So then the intermediate contents are the arch of aorta with its three branches, namely the right brachiocephalic trunk or innominate artery, and left common carotid artery and left subclavian artery. Along with that, phrenic and vagus nerves and the cardiac nerves. So the prevertebral contents are the trachea, paratracheal lymph nodes, tracheobronchial lymph nodes, esophagus, left recurrent laryngeal nerve, and thoracic duct and longus coeli muscles up to T3. So all these are prevertebral. So three different areas like immediately behind the sternum, intermediate region, and prevertebral region. So you can see all the structures. You can see this is superior vena cava, right brachiocephalic vein, left brachiocephalic vein, arch of aorta, right brachiocephalic artery. So left common carotid artery, left subclavian artery. You can see here left superior intercostal vein. This will be the left recurrent laryngeal nerve. This will be the left vagus, and this will be the right vagus. You can see here this is the trachea and this is the esophagus. All these are the structures of superior mediastinum. So inferior mediastinum, pericardium and heart divides inferior mediastinum into three subdivisions: anterior mediastinum, middle mediastinum, and posterior mediastinum. So you can see here, so this is a pericardium with the heart dividing the inferior mediastinum into anterior, middle, and posterior mediastinum. So anterior mediastinum, so anteriorly body of sternum, posteriorly fibrous pericardium, superiorly the same imaginary plane extending from sternal angle anteriorly to the lower border of T4 posteriorly. So inferiorly diaphragm. Contents will be superior and inferior sternopericardial ligaments. These are the chief contents. Superior and inferior sternopericardial ligaments, loose areolar tissue, retrosternal lymph nodes, mediastinal branches of ventral thoracic artery, and rarely, sometimes thymus may cross the superior mediastinum and extend into the inferior mediastinum. That is specifically the anterior part of the inferior mediastinum. You can see here, this is the superior and inferior sternopericardial ligaments within the anterior mediastinum. So middle mediastinum is the widest subdivision occupied by heart and pericardium. On each side, limited by mediastinal pleura, superiorly superior mediastinum, anteriorly anterior mediastinum, posteriorly posterior mediastinum, and inferiorly diaphragm. So this is the simplest way to delineate the middle mediastinum: superiorly superior, anteriorly anterior, posteriorly posterior, and inferiorly diaphragm. On either side, limited by mediastinal pleura. So middle mediastinal contents are pericardium enclosing the heart, ascending aorta. Definitely this starts from the left ventricle. Pulmonary trunk, yes, this starts from the right ventricle and divides into right and left pulmonary arteries. 4 pulmonary veins which are draining into the left atrium, and lower part of the superior vena cava which drains into the right atrium, and then arch of azagus vein which terminates in the superior vena cava, then bifurcation of the trachea, right and left bronchi. So deep cardiac plexus of nerves, inferior tracheobronchial lymph nodes, phrenic nerves, and pericardiophrenik vessels. You can see here all the structures which I have described. This is the heart with the great vessels which will be occupying the middle mediastinum. So posterior mediastinum, it is the longest subdivision of the inferior mediastinum. So in front from above onwards, if you see, you will be observing these structures, namely the bifurcation of trachea, pulmonary vessels, fibrous pericardium, and posterior sloping surface of the diaphragm. So behind it will be the bodies of T5 to T12 thoracic vertebrae, intervertebral disc, anterior longitudinal ligament. Then above it will be the imaginary plane extending from sternal angle anterior to the lower border of the T4 posteriorly. Below will be diaphragm. On each side it will be the mediastinal pleura. So contents, so longitudinal structures which are going vertically and transverse structures which are crossing horizontally. So if you see the longitudinal structures, it will be the esophagus, descending thoracic aorta, thoracic duct, azagus and hemiazagus veins, vagus nerves, splanchnic nerves, and then posterior mediastinal lymph nodes. Transverse structures will be the termination of the superior and inferior hemiazagus veins into the azagus vein, opposite T7, T8 or T8 and T9 thoracic vertebrae. The deviation of thoracic duct from right to left, this will be occurring opposite T5 thoracic vertebrae. Then posterior intercostal arteries and some posterior intercostal veins. You can see here. So this is the descending thoracic aorta. This will be the esophagus. This will be the thoracic duct. This will be the azagus vein. So applied aspects. So mediastinitis, mediastinoscopy and mediastinal biopsies, widening of the mediastinum, mediastinal syndrome. Let us see one by one. Mediastinitis, it's the inflammation of the loose connective tissue of mediastinum. So deep infections of neck spreading to the mediastinum along the facial continuity will result in the mediastinitis. Then mediastinal shift, it is an indication of lung pathology, shifts to affected side in lung collapse and decreased intrapleural pressure detected by palpating the trachea and suprasternal notch. So mediastinal mass, so 30% of the mediastinal masses are congenital mediastinal cysts. So parathyroid adenomas also will contribute to 3% of the mediastinal masses. Cervical mediastinoscopy is done to visualize and take biopsies for mediastinal masses. You can see here, this is the entire part of the mediastinum which needs to be visualized. So either we can access from here or from here. You can see here 2 locations, preferred sites for incisions for mediastinoscopy. You can see the mediastinoscope inserted here to look into the mediastinal structures, and we can also use the biopsy instruments and collect any kind of biopsy from the structures here. So then widened mediastinum, so it's a feature often seen on plain chest x-ray. So when the thickness crosses 6 to 8 centimeters, then we call it as widened mediastinum. So causes made with thoracic aortic aneurysm, maybe of ascending or proximal descending aorta. Then aortic dissection of ascending and proximal descending aorta. traumatic aortic rupture, hilar lymphadenopathy, either infectious or malignant, mediastinal masses like lymphoma, seminoma, thymoma, or some cyst, then mediastinitis and cardiac tamponade. These are few. There are multiple other causes also which can cause the widening of mediastinum. You can see here this is the normal size of the mediastinum, and see you can see here the widened mediastinum. So mediastinal syndrome. So contents of the superior mediastinum are compressed due to space occupying lesion, enlarged lymph node or tumor compressing on the following structures like trachea, which will result in difficulty in breathing, esophagus, difficulty in swallowing, left rectal angina, horse's mouth voice, and superior vena cava, facial edema, and dilated veins in the neck. You can see here facial edema. You can see the dilated veins here. You can see the tumor constricting the SVC. Thank you.